question I often see posted online is, will my eye ache or throb after ICL surgery? What's up guys, my name is Hura. I'm a refractive cataract and anterior segment surgeon here in Los Angeles, and I specialize in forms of modern vision correction like EVO ICL surgery, RLE, LASIK SMILE, and PRK. And the answer to that is yes and no. Most patients, they do just great. The eye doesn't hurt at all. There's no aching, there's no throbbing. If someone does experience some mild achiness, it's not usually the act of the surgery on the eye itself. It's usually the eyelid holder we use to hold the eyes open so that people aren't blinking or squeezing or their eyelashes aren't getting in the way during surgery. Sometimes if a patient is really squeezing a lot against the eyelid holder, there can be a little bit of achiness for a day or two after surgery, but that's what anesthesia is for. So when we do ICL surgery, everyone has an IV in their arm. We give them plenty of numbing medicine on the surface of the eye. The very first thing I do is I give numbing medicine inside the eye at the start of surgery. So it's quite rare that someone feels some achiness or throbbiness after surgery. Maybe the eye, what I tell everyone is they may feel a little itchy, gritty, or scratchy, especially for that first 24 to 36 hours. And that's just because the substances we place on the eye after surgery, the antibiotics, sometimes that can lead to the eye to have a little bit of temporary dryness. But within that first weekend of recovery or so, all of that pretty much goes away. And what I encourage people to do is go home, take a nap after surgery, use some artificial tears, and within that first 48 hours or so, all of that itchiness and scratchiness is gone as well. So the ICL surgery in terms of recovery is usually quite painless. If you've heard of someone having, let's say, a lot of eye pain, a lot of throbbing, a lot of aching, it's possible that they experienced a pressure spike after surgery. With modern ICL surgery, that's quite rare, but it sometimes can still happen. And that's why it's so critical to be seen the same day after the surgery takes place and then to be seen the next day as well. Because at both of those visits, we're checking the eye pressure. And if the pressure's too high in the eye, we have all sorts of ways to immediately lower it. Sometimes we can relieve a little bit of fluid off the eye on the spot, and that instantly drops the pressure back to normal. Or sometimes if it's not that big of a pressure spike, we can use an eye drop or two temporarily for the first several days. So as that eye is healing, then the pressure returns to a normal baseline.